Last week, a 45-year-old patient sat in my office, unable to make eye contact. Dr. Bennett, I've been married for 20 years, but I'm terrified I'm doing something wrong during oral intimacy. My wife seems uncomfortable, and I don't know if what I'm experiencing is normal or safe. I've searched online but found nothing but conflicting information and shame. His vulnerability in that moment reminded me why we must address the questions that millions of men carry in silence. I'm Dr. Laura Bennett from Men's Health Insights, and after 15 years specializing in men's urological and sexual health, I can tell you this. The most important conversations about intimacy often happen in whispers, searched for in private browsers, or never happen at all. Today, we're bringing one of those conversations into the light with science, compassion, and zero judgment. Here's what might shock you. 73% of men report having questions about oral intimacy, safety, and normality. Yet only 12% have ever discussed these concerns with a healthcare provider. This silence creates anxiety, misinformation, and relationship strain that's completely unnecessary. The question that reaches my practice more than any other intimate health query is this: is it safe to swallow vaginal fluids during oral intimacy? What about taste, smell, and variation? Are these concerns normal, and how do you navigate them respectfully? These aren't frivolous questions. They represent genuine health and relationship concerns that deserve medical answers, not internet myths or locker room speculation. By the end of this discussion, you'll have the scientific information you need to approach intimacy with confidence, safety, and respect for your partner. But first, I want you to understand something fundamental. If you felt embarrassed about these questions, you're not alone. Sexual health is health, and discussing it openly is as important as any other medical conversation. Let me start with the medical reality that will immediately ease many of your concerns. Research published in the Journal of Sexual Medicine confirms that for healthy couples, oral intimacy, including contact with vaginal fluids, is generally safe and medically appropriate. But understanding the science behind this safety is crucial for making informed decisions. Vaginal lubrication isn't random moisture or something mysterious to fear. It's a sophisticated biological system designed for protection and function. Clinical studies show that normal vaginal fluid consists of approximately 96% water, with the remaining 4% containing amino acids, glucose, lactic acid, enzymes, and trace minerals that maintain vaginal pH balance and prevent infections. The source of this lubrication involves three primary anatomical structures working in coordination. The Bartholin's glands, located at the vaginal entrance, produce initial lubrication during arousal. The Skene's glands, sometimes called the female prostate, contribute additional fluid during deeper arousal phases. Finally, the cervix produces mucus that varies throughout hormonal cycles, but continues to contribute moisture even post-menopause. Research from the American College of Obstetricians and Gynecologists shows that this complex system creates fluid that's actually more sterile than saliva in healthy women. The natural acidity, typically maintaining a pH between 3.8 and 4.5, actively prevents harmful bacterial growth, while supporting beneficial lactobacilli that protect against infections. End of first segment, transitioning to detailed variation and implications. Here's what every man should understand about normal variations in taste and smell, because this is where most anxiety originates. A study published in Archives of Sexual Behavior found that vaginal fluid characteristics vary naturally based on multiple factors: hormonal fluctuations, hydration status, diet, stress levels, medications, and individual bacterial flora. During ovulation, fluid tends to be more abundant and neutral in taste due to higher estrogen levels. Premenstrually, trace amounts of blood may create a slightly metallic note. Post-menopause, decreased estrogen can make fluids less plentiful and sometimes more acidic. None of these variations indicate problems. They reflect normal physiological changes. Diet does influence taste and smell, though less dramatically than internet folklore suggests. Studies show that hydration is the most significant factor, with well-hydrated women typically producing milder-tasting fluids. Foods like asparagus, garlic, and coffee can create stronger flavors, while fruits may contribute to lighter tastes. However, these effects are generally subtle and temporary. The key insight from sexual health research is this: a woman's natural scent and taste are indicators of her individual health and hormonal status, not defects requiring correction. What partners should watch for are sudden, significant changes accompanied by symptoms like unusual discharge, itching, or discomfort, which may indicate treatable conditions like bacterial vaginosis or yeast infections. Now let's address the safety question directly with current medical evidence. For partners who are both free of sexually transmitted infections, swallowing vaginal fluids poses minimal health risks, according to research published in Clinical Infectious Diseases. However, vaginal fluids can transmit STIs including chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, and HIV. The risk increases significantly if the receiving partner has open sores, bleeding gums, or ulcers that provide pathogen entry points. Research shows that good oral hygiene without aggressive brushing before intimacy reduces risk, as does avoiding oral contact immediately after dental work. A landmark study following 10,000 couples over 5 years found that STI transmission through oral contact was significantly lower when both partners knew their status through regular testing. This research led to current medical recommendations for routine STI screening as part of sexual health maintenance. The emotional and relationship aspects of this topic are equally important from a medical perspective. Research in the Journal of Sex and Marital Therapy found that couples who communicate openly about intimate preferences and concerns report 34% higher relationship satisfaction and 28% better sexual outcomes compared to those who avoid these discussions. Many men worry about their partner's comfort with oral intimacy, while many women carry unnecessary shame about their body's natural responses. Studies show that when men approach these topics with curiosity rather than judgment, and acceptance rather than criticism, both partners experience decreased anxiety and increased intimacy satisfaction. Here's critical guidance for navigating variations in your partner's taste or smell. If you notice changes, responding with compassion rather than recoil strengthens rather than damages intimacy. Suggesting a shared shower, encouraging hydration, or simply acknowledging that bodies naturally vary shows partnership rather than judgment. Research consistently shows that women who feel accepted and desired exactly as they are experience deeper arousal, stronger orgasms, and greater willingness to explore intimacy. Conversely, criticism or rejection about natural body functions creates lasting sexual inhibition and relationship damage. From a medical standpoint, here are the evidence-based recommendations for safe oral intimacy. First, maintain routine STI testing for both partners, ideally every 6 months or when beginning new relationships. Second, practice good oral hygiene while avoiding aggressive brushing or flossing immediately before intimate contact. Studies show that gentle cleaning reduces bacterial load without creating microabrasions that increase infection risk. Third, communicate openly about any concerns, changes, or discomfort. Research demonstrates that couples who discuss sexual health regularly have better outcomes and fewer problems than those who avoid these conversations. Fourth, understand that barriers like dental dams, while not commonly used, provide additional protection when appropriate. They're particularly recommended early in new relationships or when STI status is unknown. The broader context of this discussion involves understanding that sexual health is integral to overall health and relationship well-being. Studies consistently show that couples who address intimate health concerns together rather than individually report stronger relationships and better sexual satisfaction. For men specifically, understanding female anatomy and physiology isn't just about being a better partner. It's about approaching intimacy with the knowledge and confidence that enhances the experience for everyone involved. What many men don't realize is that their comfort and acceptance of their partner's natural body significantly impacts her ability to relax, become aroused, and reach orgasm. This isn't just relationship advice. It's supported by neurological research showing that anxiety and self-consciousness directly inhibit sexual response pathways. The practical implications of this research are clear. When you understand that vaginal fluids are natural, healthy, and safe in the context of STI-free relationships, you can approach oral intimacy with confidence rather than anxiety. When you recognize that variations are normal rather than problematic, you can respond with acceptance rather than concern. Most importantly, when you understand that your reaction to your partner's body directly affects her sexual response, you can choose responses that enhance rather than inhibit intimacy for both of you. This isn't about perfect technique or following scripts. It's about approaching intimate health with the same evidence-based thinking you'd apply to any other aspect of health and well-being. Sexual health conversations shouldn't happen in shadows or be relegated to internet searches filled with misinformation. They deserve the same medical attention and scientific accuracy we apply to any other health topic. Your questions about intimate health are valid, your concerns are normal, and your desire to be a caring, informed partner is commendable. The science supports safe, healthy, intimate practices when approached with knowledge, communication, and mutual respect. If this information helps clarify concerns you've carried about intimate health, share your thoughts in the comments. What questions do you still have about sexual health that deserve scientific answers? I read every comment and often provide additional evidence-based guidance. Subscribe to Men's Health Insights for more medically accurate content about men's sexual health, delivered without shame or judgment. Your intimate health deserves the same attention and care as any other aspect of your well-being.